Good afternoon, ladies and gentlemen, fellow citizens. Special welcome to the small media court today. This is going to be a short conference. It's one of our reporting on our COVID management situations, and today is a very special day for a lot of people who will not be paying attention, but I hope that they will find out what is said, because it's important to know what is required of each citizen. But we appreciate the fact that there are other interests taking place today. So, without further ado, I'd like to ask Dr. Paraswam to take over with his team and take us through our normal routine, and then we'll have a short period after that and a short period of a couple questions, a few questions.
Okay, thank you, Honorable Prime Minister. Good afternoon, Honorable Ministers, members of my medical team, members of the media, members of the viewing and listening public. So I'll begin with the clinical update for the 28th of May 2021 at both public and private facilities. We have now tested 178,294 cases. Total positives to date from the 12th of March now stand at 22,620. Total recovered patients 12,970. Active cases 9,192, with 458 deaths and 457 persons spread among various facilities. Total persons in step-down 177, those in quarantine 129, in self-isolation 7,925. Total persons vaccinated with the first dose so far 84,900, and those fully vaccinated 1,179. So just to update the nation on two particular issues which we discussed before. So one issue is related to a syndrome, vaccine-induced thrombocytopenia, thrombosis. So we have detected one case of post-vaccine, this syndrome in a post-vaccinated person, which meets the clinical criteria. It's between 5 and 28 days. Person did have thrombocytopenia, which is a low level of platelets, and is doing very well. It's under the care of Dr. Charles, Kenneth Charles, who is a hematologist, as well as their private physician. And Dr. Charles will go into more detail on Wednesday, I think, on our press conference. So basically, our first case, it seems very plausible, and we will report that to PAHO as well. Update on the variants of concern. There's an overall since December of 2020. Total samples sent to the UV lab, 504. P1 stands at 100 of those samples. B117 reminding it's the UK variant at 9, which is 1.8%. And since the first P1, there have been 363 tests, 100 of those P1, which is the Brazilian variant, representing 27.6% of that particular group. Just to remind, the last case of the B117 that we had was recently investigated and confirmed. We is a person that is a national. We are under an epidemiological investigation at this point. Doesn't seem to have a link to repatriation at this point. Dr. Hines and his team from Epi Unit is investigating this as a matter of urgency, and they will come back to us and give us some details in the coming days. So again, just those two incidents to report, and we go into the epidemiological update by Dr. Hines, followed by the parallel system update by Dr. Richards, and then of course Dr. Trotman would give some notes on home care. Dr. Hines?
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing and listening public, good afternoon. The epidemiological update today will be relatively brief as we move directly into the epi curve. Now you'd recognize this format as we were actually tracking the potential and eventual appearance of a couple spikes that we had thought may occur as a result of some of the clustering around the closure of some of the facilities, whether it was restaurants or bars, roadside vending, etc. And we have, in fact, in the last couple of weeks, actually seen those little spikes. So what we see first is the spike that is related to a 2-week period after April 29th where we closed restaurants. We spoke about that. And the star is actually the spike that seems to be 2 weeks after the closure, the further closure of roadside vending and additional retail. So if there was additional clustering of individuals trying to get last-minute things, that may, in fact, be one of the reasons why we're seeing higher numbers around that particular time. And as we've come forward, so far we see slightly lower numbers, acknowledging that some numbers may still come out of the system retrospectively, so these bars may get a little higher as additional data becomes available to us. But this is the sort of trend that we're seeing at this point in time. Looking at the week by week, we see that this Epi Week 21, which is the week that would have started on Sunday last, is not yet complete, but we have accrued already 3,176 cases. When we get the additional figures for today, we will get a completed or a closed week, because today is Saturday. Epi Week runs from Sunday to Saturday. So last week Sunday was, or Sunday gone is the 23rd. This Epi Week will end when we get the figures for today. And we have to date, up to the last closed or completed Epi Week, seen that the numbers of cases, while those continued to increase, the percentage or the difference between 1 week and the next started to become a little smaller. So we're hoping that we see that trend continued when this Epi Week closes. Just giving a month by month, because months are a little more familiar to the general public. So far for May, we would have seen 11,796 positives as at yesterday. And that dwarfs the rest of the totals for the previous weeks by a significant margin. We also look at the positivity, that is, out of every 100 tests that we do, how many of them come back positive, and that was running around 43%, bearing in mind that the people who are tested are those who come in with symptoms and those who were exposed, so that there's a higher probability of them being positive. So it doesn't represent 43% of the general population, but 43% of that higher probability group. The demographics have not changed significantly among those positive. Still, nearly half and half, male and female, slight preponderance among the men, and still over 50%, 54% in this case, in the 25 to 49-year-old age group, representing the people that move around the most. We have seen that shift from a larger preponderance of men among the deaths, where it was 75% prior to recently. And now that has come down to 62% of the fatalities being among men and 38% being among women. And also the deaths in the under 60 age group now comprising a little over 35, 36% of the total deaths, as opposed to being a little under 30% before. So that slight increase in those among the younger age groups, and the increase among women compared to men, but men are still predominant. There's still more men among those fatalities than women. And then just looking at the geographic distribution, the dots representing places where people were plotted. And just the acknowledgement here is that all of the population centers, all of the places where there are people dwelling, including those what we wouldn't call country roads, we have cases. So there's no place that is quote-unquote spared at this point in time. Represented at the community level, we have basically the same pattern that we had seen previously, with the darkest colors representing the largest numbers accumulated in a given community, and the lighter colors representing smaller numbers. Looking at what we had projected and then how those projections performed, one of the first things that we looked at or looking at was how our total cumulative cases performed in terms of their doubling retrospectively. And what we did find is that between the start of April and the middle of May, it only took 41 days to double from that April 5th total to just about twice that. And if we continue at the speed that we are going at or have been going at over the last couple of weeks, we may see another doubling in a 21-day period. We're looking at that landmark, and if we don't reach that landmark, then we will again conclude that there has continued to be slowing of the numbers of cases as time rolls forward and the regulations take effect. And looking at the current versus projected active cases and new cases. Those yellow dots, which may be visible to those in the viewing public, show where we could have been going if we continued at the speed that we're moving at around May 2nd. The green line shows where we actually ended up, so we didn't accumulate active cases at that previously projected rate, which is positive. It wasn't a big difference, it wasn't a large decrease, but it's a trend in the right direction. And so too, the light green bars were the sorts of numbers of new cases we could have seen if we had that strict exponential rise day to day. And the orange bars are the numbers of cases that we did see, again indicating that that strict exponential projection was not followed, which is a good thing. But we still have to look at that against the backdrop of the capacity of the health system to manage the numbers that we do have. And that is the conversation that Dr. Richards will have with us.
Good afternoon to the Honorable Prime Minister, Minister Diyal Singh, Minister Young, my colleagues and members of the media. Good afternoon to the listening and viewing population of Trinidad and Tobago. Thank you once again for your continued attendance at our conference. Ladies and gentlemen, I would like to provide an update on the clinical status of our parallel healthcare system. This information is as of 8 a.m. on May 29, 2021. The number of admissions, that is the number of persons or ill-confirmed patients, COVID patients, continues to increase. However, we have noted that the number of persons who are being discharged from the hospitals in the parallel healthcare system is roughly equal or nearing an equal ratio. Of course, the rolling averages has been over the last 3 weeks of an average of approximately 500 cases per day. The more cases per day results in more ill persons requiring care at our hospitals. I'd just like to highlight the net number of persons. That is, if we subtracted the number of persons who are being discharged at our hospitals as against those who are being admitted. And over the past months, we are seeing that the net number of persons or additional number of persons per day requiring care at our hospitals is decreasing. However, ladies and gentlemen, let us not be prematurely comforted by this decrease. As you would note, over the last week, the overall occupancy of our hospitals has decreased and is now under, for this week, under that warning 75% level. And this trend has also been noted in Trinidad and Tobago. However, this is due to the increased number of hospital beds. And over the last month in Trinidad and Tobago, we have actually tripled the number of hospital beds. The Ministry of Health continues to do our part to save lives, those of your relatives and overall the population. However, just as a bed is not a bed created is a bed filled. And we have noted that within 24 hours of increasing the number of beds at our increased number of centers, they are being filled. This just demonstrates the increasing need for ward-level beds. And again, over this week, we increased the number of ward-level beds by about 15% as opposed to last week. And we noted that there's been a decrease in the overall occupancy. Of course, high-dependency unit and ICU care are variable based on patients entering the system. Again, we've noticed a fall in hospital occupancies under the warning sign of 75%. We are still at above 75% or near maximum occupancy at all hospitals in the parallel healthcare system, except the Hoover Medical and Multi-Training Facility, which is the hospital that manages the most ill patients. We also have an added level of care, which we would have discussed over the last month. And again, we are noticing a variable number of percentages at these step-down centers. However, as fast as, again, they are activated, they are being filled, sometimes overnight. This just demonstrates the ambulance transfers, which is at 40% as of this morning. and the fluctuating time to receive care. We continue to stretch limited resources in the health sector to save lives. However, as much as in the health sector, we are trying to basically increase the number of beds, we as a population need to continue to be civic-minded, responsible, and law-abiding in this situation. On behalf of every frontline worker who has worked tirelessly over the last 17 months and who has sacrificed their time and risked their lives by going out on a daily basis to save lives, I would like to appeal to everyone to continue to practice the 3 W's. Let's continue to wear our masks properly. Let's continue to watch our distances. And let's continue to wash our hands and sanitize. We really need to practice these 3 W's, not just at our workplaces if we are essential workers or in the supermarkets, but also within our homes. If we are unwell, let's stay home and seek medical attention. Our behavior and the measures to reduce COVID-19, which are the 3 W's, are our main armor in this war against COVID-19. Thank you very much, ladies and gentlemen, and I pass you on to my colleague, Dr. Trotman.
Honorable Prime Minister, ministers, my colleagues, CMO, members of the listening and viewing public, my fellow healthcare workers, members of the listening and viewing public, and members of the media. I want to start off by first thanking all of those who have participated and joined us in the fight against COVID-19 by adhering to the restrictions put on by the state of emergency. Thank you very much. I want to emphasize today the absolute necessity for when at home to isolate from each other. Please remember, we have 2 holidays coming up, and we want to please remind you that part of isolation means no visitors at home. If they are not part of your usual base, then they should not be coming to see you. Also remember that when you are at home, you should not be sharing things like eating utensils, bathroom facilities, and we want to make sure that you continuously sanitize, not just by continuously washing your hands over and over, but wiping and keeping your surfaces clean. It is essential because you know we have some 8,000 plus people at home who are ill. And on the point of being ill, when you are ill, you stay at home, you do not come to work. And if others at home are ill, let them seek care and isolate from them. Even as you're trying to help them, you may help them and then go out somewhere else, not knowing that indeed they may have the disease or become more ill, and of course you will now be part of that vicious cycle. So again, please isolate well at home. Remember, no visitors over this period. Keep your surfaces clean, and remember our 3 W's. Wear your mask, wash your hands, and watch your distance. Thank you.
Thank you very much, ladies and gentlemen, and thank you very much to the health team for a report. Ladies and gentlemen, I want to start the few minutes that I will speak on the base arrangement that we've taken certain actions to prevent people from, or I shouldn't say prevent, to encourage people to not move out, not move around, not congregate. That is the objective of all the actions that we've taken. One of those actions is that we've closed restaurants and bars because they were places designed to bring about coming together, congregation, and movement towards those locations. Clearly, some people who are operating these facilities are of the view that they have not understood what the purpose of the closure of these places are, and they seem to always try to find a way around it to keep the business going for good reason, but it has the effect of undermining the objective of the national response. It has come to our attention that many restaurant or store owners of one kind or the other have responded to the requirement for the closure of restaurants by somehow, in a closed restaurant, is having food prepared and packaged to be sold and serviced elsewhere. Now, ladies and gentlemen, this might be good for the restaurant. It might be a good business model, but it has the effect of undermining exactly what we are trying to accomplish. One, which is to keep people away from work, so somebody's working in those kitchens. Two, encouraging people to come out, to go and to get these prepared foods, and in fact are congregating at places of distribution. So one could easily say, if that is going to be allowed to happen, it might be more convenient to have the restaurants open and serve the food at the restaurant. Because it might be that that is safer, but the bottom line is that is what we try to prevent so as to reduce the number of people who are out there and coming out there. So today, regulations would be prepared to ensure that it is crystal clear that closure means closure. Restaurants are closed. Food services, prepared food service delivery would not be available in the coming days. And along with that, hardwares will close hardwares for the next week, closed. The next week is one that we've had in, I think it was in March or April, where we have Tuesday as a holiday, Thursday as a holiday, Monday as a holiday, so it runs from that weekend into Monday. Then we have Tuesday and Wednesday as work days. Thursday is a holiday, which runs into Friday as the only work day. And this is very complicated to try to take action to treat with these, except that we do not want people to use these occasions to congregate. We examined the possibilities of additional closure, but from an operational standpoint, we have come to the conclusion that that will not give us the result that we need, because it will only encourage people to react to the shortened time by rushing to these places of service. And it's that congregation that Dr. Hines is pointing out to. Whenever there's the rush and the congregation, days later, you see the spike that goes with that. Unfortunately, there are many people in our national community who, one would come to the conclusion, are still genuinely of the belief that they are beyond this virus. And therefore, once you are well and can move around, you move around in the hope or the expectation or the entitlement that it will not happen to you. I have seen too many families. I have heard about too many families who are hurting. I know that there are many families who are dislocated in one way or the other, but the ones that are hurting and the ones that could hurt more for a longer period of time are the ones that are engaged with death, and we are trying to avoid that. Our levels of infection is still quite high, even though there is an indication that if we stay the course, that we could get to the place where we want to go. But by the same token, if we do not, for all the good reasons, we will end up in this situation at this high level of infection with commensurate high levels of death, because we are not prepared to do the bitter medicine taking that is required. So we are going to make those two adjustments. Total closure of external food support for selling of prepared food. And this does not include the caterers who cater and provide food for the offshore people and other kind of catering that are essential. Essential catering. We'll identify that. Hardware is closed for the next week. And the following week, we hope that we'll open the hardwares in some kind of a rotational basis so that you can get some element of service, because construction is closed. So hardwares really shouldn't be servicing too much construction, only for emergencies. And of course, there are a lot of people in this country who are having difficulty understanding or cooperating or agreeing to what an emergency is. And of course, the general sentiment of essential is that, of course, we are all essential. But in this situation, we have to draw some lines. So Tobago, we have been looking at the Tobago situation. The Tobago ferry service, passenger service, is responding quite well. The utilization is only 12.5% per day, even though we had the restriction of a little higher than that, but the actual utilization is 12.5%. So we will maintain that one ferry service down from Tobago in the morning and one going back up in the afternoon from Trinidad, which means that if you're going from Tobago, you can come back up from Trinidad in the evening, and if you're going to Tobago in the afternoon from Trinidad, unless you are Tobagonian in Tobago, expect to overnight in Tobago if you're going from Trinidad, because that's and we maintain the 25% capacity on those ferries. The cargo ferry continues to go Monday to Friday, except the holidays, and not on weekends, and there's plenty capacity there, so there ought to be no real shortage of cargo space. And that's Tobago. I want to say that I am a little happier today with respect to the major issue that we've been fighting for the last 3 months. You may recall that as chairman of CARICOM in January, I took over CARICOM chairmanship in January, and the outcome of that meeting, of our first meeting in January, was a public statement about the unavailability of vaccines that appear to be developing. By that time, we had no vaccine in any of our countries in January, and we flagged that, and that was a CARICOM public international position. By the time we met again in March, vaccination had started in some countries, but we here in the Caribbean were pretty much left out again from any aspect of purchase. And while vaccination was going apace in some countries, we had sporadic drops in the ocean only from gifts made available to us by the beginning of April. All countries had received small gifts from other generous countries, and we had our first COVAX in March, which was well below what we were expecting. Most countries got about 33,000 doses, Trinidad and Tobago, Barbados, Antigua, Guyana, we all got 33,000 apiece. And of course, that was the situation. And the companies that were making vaccines had taken the position that they were not taking orders from countries like ours. And in fact, we were not able to buy, so vaccines were not available. While everyone could advise that what we need to do, and we agree, what we need to do is to vaccinate the country as quickly as possible. Put effort in the vaccine. I can tell the national population that for the last, I don't know how long, my major assignment, night and day, or should I say day and night, because some countries, when we are asleep, they are up. And of course, talking to all people we can talk to. And we have been working on this continuously. We have had some response, but not any response to really move the needle in any serious direction, any serious solution while it's going in the right direction. But today I could tell you that we're in a much better position, because not only are we seeing vaccines being available elsewhere, or vaccines being approved by WHO. All of these were hopeful lights. In recent days, we have made 2 substantial payments for vaccines that will allow us to have a continuous supply of vaccines to bolster and accelerate our vaccination program. The payments have been made, and in the next 6 to 8 weeks, starting here in June, we expect to have a flow of vaccines that will keep us busy in an acceleration of the vaccination program. All I want to say about that, for good reasons at this time, is that if you are a citizen of Trinidad and Tobago, Vaccines will be available to you for free, and the best vaccine is the one that is offered to you unless you have been advised against it by your healthcare, your specialist healthcare advisor, your doctor. We do know that many of us have certain conditions which may cause advice to be that the vaccination may be an additional risk that you may want to avoid. But by and large, all the people who are to be vaccinated now, who need to be vaccinated, who do not have that issue, I would appeal to you to get vaccinated as quickly as possible. The way out of where we're at is to have as many people vaccinated as possible. So what we are aiming to do now, as quickly as we can confirm and have the vaccines in our hands, we will want to get them into arms as quickly as possible. And we are in a position now where the month from June, July, August going forward, we are going to be vaccinating in a very significant way, because we expect to, that our payments will result in substantial inflows of vaccines to us. As I speak to you now, we are readying ourselves to pick up 10,000 doses tomorrow morning from Grenada. The government of Grenada is offering us 10,000 doses, which they do not have an immediate requirement for inside of their expiration zones. And you would have seen, as a result of our inter-CARICOM continuous conversations day and night, we have been able to pick up some vaccines from some of our colleagues where those vaccines were in danger of becoming still expired. But we here in Trinidad and Tobago, we have the infrastructure, we have the demand, and thankfully we have the vaccine acceptability, and we are going full speed ahead with that. So tomorrow we'll have an additional 10,000. And of course, because we have confirmed an additional supply of Sinopharm vaccine, we can use up all that we have in hand now as first dose, because we have a confirmation of vaccines coming in to create the second dose. So we will continue to be busy with first dosing, and we will do second dosing as we go forward. And that will put us in a much better position. And fortunately, a lot of our citizens want to be vaccinated. That's going to put us in a very good position. So, one other point I want to make, and it is this whole point about misconception and misinformation. I saw two spokespersons from the business community last night. In fact, let me back up a bit. I did ask 5 of my colleagues, I think it was, led by Minister Young from the Office of the Prime Minister, to meet with the business community to hear what their inputs are into what we can do or should do, or what they'd like to see to improve the situation. And that meeting took place and so on. Coming out of that meeting was this question of the hours of curfew. And of course, you would have seen that there's no consensus there about that, because before we established 9-to-5 curfew, we had discussed and assessed all of the pros and cons as to what hours the curfew should start, what hours it should end, and because we know we are trying to keep certain activities going and so on. The 9-to-5 curfew still remains, for us at the level of the government, having heard what was said, still remains the most sensible arrangement. Otherwise, we will solve one problem by creating others. And the last problem we want to create is one that will precipitate the kinds of acceleration of gatherings, as we know will happen if we have the curfew starting at 4 o'clock, for persons to go home by 6 o'clock, your grocery is going to close at 4 or 3. That is not in itself an assistance. That will create new problems, because we know people are going to say and will have good need to go out to get service there, and we want to make sure that that service is not in itself a breeding ground for the spread. So we remain with the 9-to-5 curfew, and on those 2 holidays, Tuesday and Thursday, I keep saying Tuesday, Monday and Thursday, the Attorney General would be asked to make whatever adjustment that is required, so that we will have some further restrictions, some daytime curfew, those 2 holidays. And I want to advise the population that in the state of emergency that exists, it is not a freako in the daytime and curfew in the night. It is a stay at home and only come out if you are essential or in emergency. We are going to look at those regulations to see whether we need to clarify them any further. Out in the street, essential or emergency. Because what we are seeing is that there are, in fact, I'm receiving reports from the authorities who are out there, that in some instances, there are more people out in the daytime now than in the normal days. Fellow citizens, that is exactly what the disruption is about. The stay at home is to prevent that from happening. And if that is what is happening, then we are not going to get a full point for the stay at home, but we're going to get less than half a point if we continue to be out there. There is this abiding requirement of some people to be out in the road, to be out there mixing. And I've seen some things that defies logic, where sharing a bottle of white rum in a spirit of engagement, of frolic. I don't know if people understand that what you are doing is the perfect infecting action. I really don't know. What I'm concerned about is what is driving that, and how could anybody in a pandemic, getting the reports every day of people who have died from that, and the only thing you could find to do is to pass a bottle from one person to the next, from one mouth to the next, when in fact, what we're trying to do is to prevent a virus from going from one breath to the next. But we will continue, and we are approaching a period in this response where our vaccination would be much accelerated, and as we get the payments that we made are significant and would take us to breaking the back of the non-vaccination situation. And starting in June, we'll have an inflow of vaccines that will keep us going in that direction. So I want finally just to appeal to the population to appreciate and understand that we are in a pandemic. Don't wait until it is somebody who is known to you or in your family who dies to realize that this is a life and death situation. We do know that one of the restrictions one of the pieces of advice we've given is that if you are sick, you stay home. That is still in place. And if that sickness is in fact the virus symptoms that you have, and you stay in place, then it means that you have to, as far as you're able to, isolate from the rest of your families, because we do know that there are a number of totally infected families out there, where by the time somebody gets sick enough to want to be hospitalized, to come to the attention of the authorities, because they were mixing with the family, that the whole family has got infected, not just have to go in quarantine as a primary contact situation, but many people in the family are infected, and their extended families. We also know that there are many households where you can't choose your bathroom, you can't choose your space basin and your sink, but please, those places, sanitize them on an ongoing basis. Appoint somebody in the household to ensure that the sanitization process takes place, and appoint somebody in the household to make sure that reminders are given as to how close you are if somebody is ill in the household or somebody is not feeling well. We've had a number of reports starting with somebody not feeling well, feeling a little queasy, a little fever, getting the home care, but the home care is in itself an infection zone. Try and avoid that wherever you are, because every number, every one is important, every life is important. Every infection goes to 2, and 2 goes to 4, and 4 goes to 8, and 8 goes to 16. That's how it goes, starting with 1. So if that 1 is avoided, we could break the chain of infection. So that is where we're at, and I'm pleased to let you know that there is a lot more light coming through the tunnel at this stage. But we need to stay the course. We need not to get weary at this critical point. We need to stay the course. I could tell you now, from what we are doing, June, July, August, by September, with our children about to go out to school, we will be in a much better position than we are now and could make decisions then that we cannot think about making now. So if you have a couple of questions, we'll take them. Oh, sorry, Minister. We'll tell you about the vaccination program, how it's going.
Thank you very much, Honorable Prime Minister, Minister Young, CMO, doctors, ladies and gentlemen of the media, the viewing and listening public, wherever you are. It is my pleasant duty to bring you up to date on what is happening on the vaccination program. But before I do that, I was at Port of Spain Hospital yesterday, and although we always thank doctors and nurses, a ward attendant, Kevin, said, I never speak about ward attendants. So ward attendants and Kevin, wherever you are in the 5 RHAs, thank you. Thank you to all healthcare workers. Okay, the vaccination program. Last week I would have mentioned that we want to accelerate the vaccination program in the homes for the elderly. We had put aside 1,000 doses of Sinopharm vaccines. I can tell you to date, we have done 175, so that is going well. However, we are not getting all, nor do we expect all, but we need to get much more guardians and children of those elderly persons in homes to sign the consent forms. Today we are vaccinating down in Princestown and so on in the County Victoria. We started the Sinopharm rollout on Friday, 21st May. We have had 8 vaccination days so far. To date, up to yesterday, we would have given out 20,642 doses of Sinopharm vaccines. The uptake is 2,500 a day, which is phenomenal. And I want to thank the people of Trinidad and Tobago for showing their faith in the Sinopharm vaccines. We started vaccinating employees of major ministries. We started that on the 24th of May with the AstraZeneca vaccines. To date, we have vaccinated 4,682 employees of different ministries, and that is ongoing. It is now my pleasant duty to alert the national community about the start of the second dose rollout of the AstraZeneca vaccines, which we started on Tuesday, 6th April. So the following slides relate only to the administration of the second dose of AstraZeneca vaccines, for which about 60,000 persons have been vaccinated. So here we go. The slide will show you, starting from the left, we began the first dose on Tuesday, 6th April. We finished on Monday, 10th May. The recommended interval is between 8 to 12 weeks between doses. The green on the right-hand side shows you now, we will be beginning the second dose administration of AstraZeneca for those 60,000 persons already received their first dose on Monday, 7th June. And we hope to end it on Friday, 9th July. How do we intend to do this? We have designated 5 mass vaccination sites. Why? Because we are not going to be mixing vaccines deliveries between health centers, which are currently doing Sinopharm. We don't want that to happen. So 5 mass vaccination sites will be dedicated solely to the administration of the second dose of AstraZeneca vaccines. And they are the National Racket Center, Tacarigua, and for those in the southeastern part of the country, the Mayaro Sport Facility, next to the Mayaro Health Center. Under North Central, University of Trinidad and Tobago UTT Campus, Monroe Road, which was already used. Northwest region, the Paddock at Queen's Park, Savannah, which we are familiar with, and Southwest, Sapa. So these are the 5 mass vaccination sites. We intend to vaccinate, on average, at each site, about 1,000 a day. That means we can do about 5,000 per day across all 5, which means to deliver 60,000 doses, all I need are 12 vaccination days. 5,000 a day across 5 sites, 12 days, 12 by 5, 60, I would have covered 60,000 doses in 12 vaccination days. We will be starting initially from Monday, 7 June, and we will run these for maybe Monday to Friday, Monday to Saturday. We have to give our healthcare workers some degree of rest on a Sunday or a Saturday. We will play it by ear, but we have more than enough time to administer 60,000 doses, starting on Monday, 7th June. How is this going to be done? The RHAs have your names and numbers already. They will call you. You don't have to call. They will call you, and you will be called in the order that you got your first dose. So for those who got your first dose on Tuesday, 6 April, they will be called first, and so on. So no need for 60,000 persons to call the centers. We will call you, and those calls have already begun. So persons have already been told to come on Monday, to come on Tuesday, and where to go. So we asked that you bring your immunization card and your ID card, so we could record on your immunization card you have been fully vaccinated. So by the middle of June, by July 9th, we will have 60,000 persons, in addition to what we have now, 1,179, fully vaccinated. That is the plan going forward. In addition to that, the Sinopharm first dose is ongoing. I will announce later on the schedule for the administration of the Sinopharm second dose. So by July, August, as promised, we will have in this country 134,000 persons fully vaccinated with 2 doses of either Sinopharm or AstraZeneca. And as the Honorable Prime Minister says, as more vaccines come in, which we expect from next week, those numbers will only go up and up. So this is where we are. Good news, we are starting on Monday, 7th June, for second dose AstraZeneca. Thank you very much, Honorable Prime Minister.
Thank you, Minister. I just want to, in this operation that we're doing here, I want to thank the Prime Minister, government, and people of Grenada for sharing with us. I think those vaccines are coming from the COVAX supply, which they have not been able to use yet. So those are like AstraZeneca vaccines.
Yes,
right?
they are.
So I thank them very sincerely, and I hope that the occasion doesn't arise where we are required to reciprocate. But in the event that we have to, we will, once we have stuff in hand. And we hope that they continue to see fairer winds than we are seeing at the moment. At this time, I was saying, before the minister spoke, I was talking about the availability of vaccines. And what I had seen last night on the television, there were 2 persons speaking for business organizations, making statements or requests to the government to remove the restrictions on the private sector, to allow the private sector to get involved in vaccine supply. I don't know how to say it in English again, except that as of now, and until the situation changes, vaccines are not being sold to private sector entities like the ones who are speaking here in Trinidad and Tobago. Even where there are agents for the manufacturers of vaccines, long-standing agents around the world, the manufacturers of vaccines who have their agents in our countries and other countries are not supplying vaccines through agents. So far, and until that changes, the vaccines are being made available to sovereigns, meaning to governments. And I can go further and say to large governments. In one instance, one of the major producers of vaccines has been talking to us now for what, 3 months?
More than 3 months.
And the next step that they have with us is to provide a heads of agreement and a price for the vaccines, and they are not prepared to go beyond that. And I don't know where the private sector is going to get the vaccines from, but I'll tell you, we have put no restrictions on private sector with respect to the obtaining of vaccines. Anybody bringing into this country any medical supply to go into people's bodies, there are standing arrangements in place for that. So if anybody in the private sector can get a truckload of vaccine, as they can with Panadol or whatever, it has to pass through a screening that satisfies the authorities in this country that that medical product is what it says it is, and it meets the standards of requirement to enter the country. At no time during this management of this pandemic did the government ever take a position to the private sector that you don't get involved in vaccine production, we keep it unto our own selves, and you don't bring any vaccines here because we don't want it. All we have said all along, over and over and over and over, that we as a sovereign state have been alongside others trying to buy vaccines. Vaccines are not available in commerce. And I went further to say, in conversations with my colleagues throughout the CARICOM, except for what we have bought through the COVAX, paid for last year, October, to get the COVAX supply that we are getting now, nobody else has sold us or offered us, or we have not been able to buy any vaccine in any country in the CARICOM. So I don't know why this is a conversation that is giving the population the impression that vaccines are available to the private sector that is willing to help, but the government needs to lift the restriction. There are no restrictions. As a matter of fact, I'll be the happiest person in the world if any private sector entity in Trinidad and Tobago could come forward and say, I have been able to obtain WHO properly chain of custodied vaccines, and I have it available for sale in Trinidad and Tobago. I'd be the happiest person. But as I can tell you, being in this conversation now for 5 months, non-stop, I know that that is not available, and it may become available in the near future, but as of now, let it be clear that there is no restriction on private sector involvement. And if private sector involvement means that the government hand it to them to handle what we have in our hand, I'm simply saying now that is not necessary. The government's infrastructure, given the limited supply that we have, and trying to ensure that it goes to the right people at the right time, we are in fact on top of that. When vaccines become much more available and more easily available, obviously we can get more involvement, and there are no restrictions except the restriction to satisfy the importing conditions of a product that has to meet the conditions like any other medical import into Trinidad and Tobago. So I want to make that abundantly clear. And we didn't need a meeting with the private sector for that, because I've been saying that all along. Since March, I've been saying that. But of course, if you don't believe what I'm saying, surprise me, right? I know that efforts have been made by the private sector without government restriction, and of course, those efforts have not borne fruit because the product just isn't available. We are the significant payments that I've mentioned for the volumes that we expect to get, they do not involve our very continuous and persistent diplomacy with the United States officials, where we've worked 10 times as hard as is anticipated, and hoping that when the barrier is lifted there, that will become another source of supply. We are anticipating that, but we have no control over that. Eventually, from statements made from the American leadership and the government there, they are indicating that they will either boost up the supply to the COVAX, or we are anticipating that there might be some bilateral distributions. We have to wait and see. but we are in touch with persons in authority at the highest level in the United States administration on an ongoing basis. So if you have a couple of questions, we'll take them now.
Given that we have spent significant amount of monies on vaccines, could you tell us how much we have spent and which brand and how much we have ordered?
I mean, but I said, we're shopping into baskets. As you know, there are different brands available. We're not sure in all cases what brands you're going to get, but we're certainly going to get most. One of the payments we made is for more Sinopharm for second dose, and that is why I was able to say that we're going to use all that we had now as first dose. And of course, we are in the basket of other brands, and we were on the medical supply platform where they have a basket of vaccines that they are going to get, and we've made a payment into that, and we expect to be supplied from that. But let us not get into the brand business yet, because the one thing that is going to destroy our effort is the brand and vaccine preference behavior. As I said earlier on, the vaccine that is available to you in front of you now, the earlier you get vaccinated, the better. So we are trying to avoid that road about which brand to wait for and which brand is coming, because we can't guarantee that, because we are procuring from a basket.
And the amount we spent and the numbers that we paid for?
The Minister of Finance will have those figures, millions of dollars. So the Minister of Finance, I think we are spending significant amount of millions. And of course, we are committed. Once the vaccine is available to us, we are committed to make the payments as required.
Earlier on, the CMO gave a case of one adverse effect of the vaccine, sir. What words of encouragement, no, it's for you. What words of encouragement would you give to the population who may be skeptical now, having heard that?
Well, as I've always said from the time we started here, it's management of risk. What we do in response to this virus is a management of risk. We have vaccinated, you heard the figure from the minister, how many thousands or tens of thousands of persons worldwide. Millions, tens, hundreds of millions of people have been vaccinated. This condition has occurred in one or two situations in Trinidad and Tobago. We have now heard about one condition in the tens of thousands. We take it in that vein. We've heard about plane crashes. We've heard about motor car accidents, where the risk is far greater. But we continue to use our cars and our planes, and even food poisoning is a risk that you face. But the risk of, being food poisoned from food don't mean that you don't eat. And the whole world is using these products. And the negatives are that very few people with special conditions or special reactions will have a negative reaction, but it does not mean that the product is not to be used or is unusable, because the benefits far outweigh the risk and the downsides. So that's what I continue to encourage the population to get vaccinated. Get vaccinated once the vaccines are offered to you. And the one that we waited a long time to get WHO approval for Sinopharm vaccines, they are now being available to us. They're being utilized, and that is carrying our program. We are going to get other vaccines that are more Sinopharm from the American platforms. We may get different vaccines. Let us not get into the vaccine preference arrangement. Let us get vaccinated as long as we get the vaccines.
I don't want to rub my colleagues off questions, but I want to stick in the vaccine vein for 1 second. For the CMO. Quick questions for you, sir.
Yeah.
Regarding the one adverse effect that we have had so far, which vaccine did the person take? And also for people who would have had the first shot of any vaccine, who then got COVID, what, if any, advice?
Okay, sure. So the vaccine that person would have taken would be the AstraZeneca vaccine. That side effect is a known side effect. It's the rate is 4 in a million, roughly 1 in 250,000 of that rare side effect. In terms of having your second dose, if you had COVID in between. Yeah. So WHO would have changed their advice somewhat for persons that would have had COVID, and then forget first and second dose. So you have COVID, WHO would now say that you can go a little less than 6 months in terms of the time for vaccination post-COVID. CDC's guideline says 3 months thereafter. WHO doesn't put a time on it. What they want to say is that the acute phase is completed and you can have your vaccine. So generally the advice now is we're looking at about 3 months based on the CDC's guideline and the WHO's guidance as an international mark. So 3 months post your first vaccine, even if you have COVID, or if you had COVID and you're going to have your vaccination, we delay for at least 3 months or until your physician gives you clearance that one, you don't have long COVID, the COVID has cleared completely, or you don't have any other medical condition that precludes you. I will take that to my national tag group this week to get a position on it in terms of Trinidad and Tobago, and that will be circulated to the population as soon as we complete. But more or less, the WHO has slightly loosened their position, and CDC is saying 3 months post-infection.
Dr. Parasram, Mahalia Joseph Horton, TVP News. On this same syndrome, I don't know if you'll be able to say every person had any comorbidities.
I wouldn't want to go into the particular details, but I would say that the person did match what was being seen all over the world in terms of the category of persons that we would expect this kind of side effect to happen in. And Dr. Charles, when he comes on Wednesday, we will go into full detail about the syndrome, and he may give a little more detail about the person, trying to keep confidentiality as best as we can.
Prime Minister, one quick question. I know you outlined that the food services for external parties would be closed for now, but what about groceries and bakeries that are selling food, because we are seeing people leaving home to buy food?
We have left that. We acknowledge that people will be on the move for that. We acknowledge that people may want to congregate. We encourage that you don't do that. So supermarkets will continue what they're doing, supplying food to people. Bakeries will still bake and supply. At the points of distribution, they are required to be observant of the protocols. What we did in terms of trying to remove movement and distribution is we closed the restaurant and service trades of that nature. People have got around it by simply preparing food, using the same staff, I presume, and shipping that off to another location, which might be inferior with respect to the handling of the crowd and population. And the population is responding to that by congregating for that receipt. And therefore, we have to do something about that.
Could you say if we would be seeing more police patrols, because we are seeing where persons in communities are cooking food at home and selling it as well?
Well, you would have heard about a number of policemen who have come down with COVID, some of whom have died. We have brought out more reserves in the Defense Force, but we can't police every person or every household. And insofar as there are people who are getting around it, all they're doing is increasing the risk for all of us. That is the long and short of that story. And of course, some of them would run afoul of the law and some of them will escape laughing. Right? But we are appealing to people. We are going to get out of this situation as quickly as possible, insofar as we cooperate as much as we are able to. We do know that some people have difficulty in trying to comply, and that's why the heavy hand of the law is not brought down on every individual who can be shown to be running afoul. There's an encouragement going on, but we expect that the law is going to be observed and that the protocols be observed, otherwise we're wasting time. This is a matter that involves everybody being the person who takes the decision that I will not be the one that is spreading it or creating an environment for spread. And where there are people who are creating the environment for spread, we will try to see whether we can discourage that or enforce it away.
First to you, seeing as the CMO is saying that the WHO has now revised its post-COVID vaccination plan from 6 months to 3 months, do we expect you to get your vaccination within this 3-month period?
I would love to be covered by vaccines. And I have had all the advice I can get from the doctors who have been looking at me, and I will take their advice at their time as soon as I'm able to, because I am not, as you may know, that I am semi-isolated, and I am not making any joke about this. I am hardly out there because I don't want to be in a situation unvaccinated where if I was vaccinated, I could have given myself a better chance of surviving. I want to survive. And as soon as it is clear for me to get vaccinated, I will be vaccinated.
And my second question is, Mr. Minister Dial Singh, I'm sure you've been looking at this ongoing situation with the NCRHA CEO and the changeover of the doctors at Cuba. If his information is accurate, that there was a 60% survival rate increase at the hospital, does that mean that we are looking at a lapse in the way the doctors had previously dealt with the situation?
Not necessarily. I think that press release is open to all sorts of interpretation, and the Chief Medical Officer and I have been discussing it, and he will give you the answer.
So basically at this point, we heard the announcement as well at the ministry. So what we have been doing all along through the epidemic is we do what we call mortality and morbidity meetings. And that happens usually every month. So that has been ongoing. So anyone that would have died, or what we call near misses, there's a group of physicians, all the hospitals get together, we look at the cases, we want to learn what has happened, why it has happened. We haven't found anything untoward so far. We will continue to do that. The team is led by Dr. Trotman, as well as with oversight from Dr. Richards. And we will do that in particular with the institutions again this month. And of course, if we pick up anything untoward, we will take the necessary action with the different RHAs. But so far, our meetings have been good in that it has led to picking up in our unique scenarios different clinical presentations, which is what is meant to be, and strengthen our response.
Evaluated, basically.
No, I mean, it's a statement that was made from the CEO. So ministry has now seeing that statement out there, we continue doing what we are accustomed doing in terms of our meetings, but there hasn't been anything that we found that bears, when you say statements like that, 60% reduction in an institution, we see the numbers remain more or less the same in terms of deaths throughout the system. It could just simply mean that there are a greater number of deaths in another institution for that particular time frame. But again, it has to be looked at.
Prime Minister, if you could give us some clarity on the Monday and Thursday curfew, daytime curfew.
Monday is a holiday, and Thursday is a holiday. We would like to take action to ensure that nobody's going to work unless you're in emergency or essential of the essential, that you stay in. We don't want people out on the street enjoying that holiday out on the street. And we'll make the regulations to go with that, and you'll hear about that before.
And how soon will we get this?
As soon as the Attorney General makes the regulation available, it will be made known to the public what is required. But it's simply stay indoors. It's the same regulation from before. But we may clarify it a bit further, because we are seeing a lot of people treating the daytime hours as a free-for activity. And we're saying that is not what's going to do it. The ideal situation is only come out in the daytime if you are in the essential workforce or you're in emergency. Or you're going to collect your food supply to go back home or something like that. We are seeing excessive movement outside, which doesn't fall into that category. And at night, if you're on the night shift only, that sort of thing essential. But it is the excess non-essential that we are aiming to get at. So we like the population, enjoy the holiday, and let me take the opportunity to wish East Indian brothers and sisters, happy, and the national community, happy Indian Arrival Day, which is what we're celebrating on Monday, and on Thursday, the Christian community celebrates Corpus Christi, and we all celebrate, but let us not congregate to celebrate.
I have one two-part question.
You have one question after this, because we are going to be ending one question each, and then we've crossed the time limit. Thank you.
Health Minister, one question, two parts. CSEC is coming up. Some parents are being told that they need certain supplies. any consideration to opening bookstores, but it's the only place they could get these supplies, just for that. So
those are not questions posed to me. Those regulations we make after consultation with the Honorable Prime Minister. Yeah, yeah. So you can get your pens and pencils and things, but you know, we just want people to be safe.
I just want to say, for the umpteenth time, whatever you have to get, whatever you want to get, if in getting it, it results in a congregation of the population inside stores and rushing and so on, those situations are what we're trying to avoid. So we'll have to make arrangements to avoid them in one way or the other. Yes, you have a question?
Yeah. Well, just first of all, just to clarify, Minister Dialsing, you did not include Tobago in your rollout of the second dose AstraZeneca site.
No, so the dates remain the same. That's for Trinidad and Tobago, but Tobago deals with their infrastructure to suit their own capacity there. So, but the national rollout starts on Monday, 7th June. Yeah, thanks.
Dr. Richards, if I can get you for a second, do you have any data to show us what is the survival rate of the persons who have deteriorated and need ICU and HDU care?
Thank you for that question. That at this point in time, we don't have those exact statistics, but it's something that will be in the work between the epidemiology division and our mortality and morbidity meetings.
Thank you all very much for coming, and thank you for communicating, and thank the population for paying attention. Let us stay the course. We're almost there. We're almost there. Thank you very much.